Riverside Healthcare puts the health and wellness information you need well within reach.
Welcome back to the Well Within Reach podcast. I'm your host, Helen Dandurand, and today I'm going to be joined by Dr. Ramanpreet Grewal, family medicine provider at Riverside's Watseka campus, to give us some important information about RSV.
Healthcare can be confusing, but thanks to your My Riverside MyChart, you can easily manage not only your care, but your family's as well. With a single click, your My Riverside MyChart lets you stay well connected to the same information your provider sees. You can view your health history, get test results, request prescription refills, pay your bill, or make an appointment. Manage your care from anywhere, your laptop, phone, or tablet. Learn more and enroll today at riversidemychart.org.
And we're back with Dr. Ramanpreet Grewal. Thanks for being here today.
Thank you for having me, Helen.
Yeah, of course.
Good to be back.
Yeah, I know. We've done this before, so it's definitely fun to keep going and learning new things together.
Yes, of course.
So can you, for the people who don't know who you are, can you give us a little bit about your background?
Yes, Helen, for sure. Hello, everyone. I'm Dr. Grewal. I'm a board-certified family medicine physician. My primary area of focus is providing preventative care to the population in Watseka. I work as a primary care provider at the Riverside campus. Like I said, I did my residency just recently from a community hospital in Pontiac, and here I am a year later, maybe a little bit wiser.
Yes, hopefully.
Yeah.
Awesome. Well, great. So like I said, today we're going to be talking about RSV, which we hear a lot about these days on social media and in the news. A lot going on. So can we start with you telling us a little bit about what RSV is?
So RSV is a very common respiratory virus that usually spreads around wintertime. RSV stands for respiratory syncytial virus. It normally only causes mild symptoms like cold-like symptoms, some cough, congestion, but sometimes it can also cause serious infections that may lead to hospitalizations and even ICU admissions. You must have been seeing that on the news these days.
Yeah.
That it's kind of spread. Yeah.
Yeah. Okay. We'll get into some of that a little later, but going into the basics, how do people get infected with this? Is it like any other virus?
So RSV can spread easily from a person to person. This virus lives in the droplets that go into the air when a sick person coughs or sneezes. One can also get it from direct exposure to the virus droplets. Like, for example, if you're infected with it and you might just have some mild symptoms, but if you go and, let's say you're visiting a newborn and you go kiss that child on their cheek, you might give it to them. Other ways are that, if you cough on your hand and then you touch a doorknob, you open the faucet, or you just kind of touch your clothes, the RSV can also kind of live on hard surfaces or common surfaces for a very long time. So if somebody touches those same things again and they don't kind of sanitize their hands and then they touch their nose or their face, they can give it to themselves.
Got it. Okay, that makes sense. That's kind of what you normally try not to do with other sicknesses too. So that's good that it's the basics. So what are the symptoms to look for? I guess specifically in children, since we know that that's who it can be kind of worse for. And how do those differ from other common colds or things like that?
So RSV usually begins like a regular cold and most commonly causes bronchiolitis in children. Some children may just have a stuffy nose, mild cough, fever. Fever is defined as temperature that's more than 100.4 degree Fahrenheit and some decreased appetite. Now, the bronchiolitis can also progress and cause other symptoms like faster breathing, pauses between breaths, wheezing, a severe cough that may last for 14 days or longer, some trouble eating and drinking. So if your nose is stuffed, the child might not want to eat as much because it's hard to catch a breath and just kind of things like that. So the flu, COVID-19, RSV, and there's another virus that's usually only causes common cold, is what we call it in layman terms. It's called adenovirus. So they all spread through the air they're present in the droplets. Now, flu itself is caused by the influenza virus. The COVID-19, as we all know, is caused by SARS-CoV-2 virus, and RSV being caused by the virus itself, the respiratory syncytial virus. Now, it's also possible that one person may be infected with multiple viruses at the same time, just kind of depending on their immunity or their exposure and things like that. Now, the biggest difference between flu and RSV would be that flu usually starts with like a high fever, and it's associated with aches and pains. That, along with COVID, can also have other GI effects, like you might have some diarrhea, some nausea. COVID in general may also cause some sore throat, and the most common would being difficulty tasting or smelling. So that's kind of like a broad differentiation, but testing is the key to identifying viruses. So with symptoms of flu, COVID, RSV, they're all similar kind of, and it's like a perfect storm of all of these three viruses kind of circulating in the environment right now. And the only way to know for sure which virus you have is to kind of get tested. So we do rapid antigen tests. We also do PCRs. Those are two most common tests that are used. Gold standard would be viral culture, which we don't do because it takes a lot of time. By the time patients normally also recover, by the time you get the results. Now, why would you want to get tested? Because with COVID, you have to isolate. You have to make sure that we're not giving it to other people, when to wear a mask. So just kind of just what to do after you have these symptoms just kind of depends on which virus you have.
Got it. That makes sense. So for RSV specifically, how long does that typically last?
So RSV typically lasts for a week or two. Most kids get better on their own. And like I said, some people might end up having like a longer infection, which would be in people who have weakened immune systems. Then they can maybe be ill for a month or maybe 8 weeks, things like that. And people with RSV are contagious for about 3 to 8 days.
All right. We're going to take a quick break to talk about finding a primary care provider. Riverside knows that your health is your greatest asset and that your primary care provider is your partner in health. So you can find a primary care provider that fits your needs at riversidehealthcare.org/primary care. All right, and we're back here. We're going to go into, why is it considered to be so serious when a young child, like an infant, is diagnosed?
So, mainly for young children and infants is because they don't have the immunity. That's the best explained. Now, RSV, this virus let's talk about how and what it does when it enters your body. So if you inhale it or if you somebody sneezes into your mouth. So at the back of your throat or back of your nose, that's where the virus kind of replicates, and then it goes further down into your windpipe. Through the trachea, it goes into the bronchioles, hence the name bronchiolitis. So when it enters the bronchioles, it causes a lot of inflammation over there, which leads to lots of secretions, and they kind of start to block the airways. So this makes it hard to breathe, and especially in preterm infants because their lungs are not as developed, or in patients or people who are more than 65 years of age and they have other lung issues like asthma or COPD, or even if they're chronic smokers, they develop severe infections like that. Now, RSV can also cause lower respiratory tract diseases like I said, bronchiolitis. It can cause some bronchospasm, pneumonia, and acute respiratory failure in children. It also causes apnea.
Gotcha. Okay, that makes sense. So what kind of, then I guess you're saying it would restrict kind of airways and airflow and things like that. So obviously just hearing that sounds like it could be life-threatening, but it definitely could be, right, for the right person. Correct?
Yes.
Yeah.
Yes. So it's very important to just kind of identify when is it time to go to a doctor, or when is the time to go to the ER.
Yeah. So what would you say? If your kid is just sick, then you would say, you need to go figure out what that is And then from there, like when would it be time, if you know they have RSV but aren't doing well, to go to like the ED?
Yeah, to warrant a visit to see a doctor would be if the symptoms are either getting worse or if they're not improving after 7 days, a fever of 100.4 or higher, or if the symptoms develop in a child who's younger than 3 months of age. For the ER, immediately head to the ER if your baby exhibits any signs of dehydration. That is, if you feel like their tongue is dry, they're not making as many tears when they're crying, or there's a decrease in the wet diapers. If you see that they're doing belly breathing or using muscles of their ribs or neck, so you'll literally see some retractions between the ribs, or you'll see that their neck muscles are kind of getting hard or in spasm, is how you can kind of relate to it. You can, if you notice that your child has some flaring nostrils, or if their head is bobbing with breathing, or if they have like a really high fever.
Got it. That makes sense. So once they go to a doctor, how would RSV be treated? Is there medication?
So for RSV, now let's talk about when a child is otherwise doing okay. There's no antibiotics because it's a viral infection.
Okay.
Sometimes we have patients walk in with the expectation of an antibiotic. So there's no antibiotic.
Me, I'm like, please give me something. Help me out here.
Yeah. And for children especially, antibiotics, cough medicines, decongestants, and sedatives are not recommended. Cough medicines and decongestants have not been proven to be helpful at all and are not safe to use in young children, especially children who are less than 2 years of age. And a sedative can basically mask symptoms of low blood oxygen and difficulty breathing. So obviously that's not recommended. Otherwise, there are a few things that you can do at home, and that's what we always kind of recommend to the parents of our patients, would be to just kind of make sure that your child gets enough fluids, use a humidifier in the room where your child sleeps. If you feel like your child is uncomfortable because of fever, you can give some over-the-counter medications like acetaminophen or brand name Tylenol, or ibuprofen, brand name Advil or Motrin. But be sure to read the instructions carefully. Never give them aspirin. So any child younger than 18 years old should not be using aspirin. You may remove the mucus from your child's nose with a suction bulb. If your child is older than 1 year, then feed them warm, clear liquids to kind of just soothe their throat and help them loosen their mucus. Sleep in the same room as your child so that if anything happens overnight, you're available right away and you can help them. And the last but not the least would be do not or allow anyone else to smoke near your child.
Gotcha. All right, that makes sense. I thought that there was medication, so I'm really coming at this with no info. I guess I don't have children, so I haven't looked into it before, but that's really good to know. So it's a lot of things that you will be doing at home to help your child. So to wrap this all up, how would you recommend we work to prevent this and to stop the spike of people getting infected with this right now and in the season?
Well, Helen, as there's no vaccine for RSV, there are 5 different types of RSV vaccines that are under study at this time, but maybe we'll have a vaccine in 2 or 3 years. They're kind of doing studies on them.
Wow.
But most likely it won't be something that would be given to all of us. Maybe it will be only for kids or older adults who the virus would impact the most. So it kind of depends on us to make sure that the virus does not spread. So basic hygiene, like wash your hands and your child's hands often with kind of soap and water, or use alcohol-based sanitizer. Teach your child to cover their mouth when they cough, or have them cough into their elbow. Don't share glasses, cups, or utensils. Clean things that are touched a lot, like counters, sinks, faucets, doorknobs, phones, remotes, and light switches. Stay away from people who are sick.
Yeah, that makes sense.
Yeah. And make sure your child gets all of the recommended vaccines, including those of flu and COVID-19.
Great. That's awesome. I've never really, I don't get me wrong, I clean my phone sometimes, but I should probably, all the places that it goes every day, I probably should clean that a little bit more. So, no, that's really great. Sounds good. Well, I think we covered a lot here, and I hope that this is helpful to someone, but thank you for joining us today, Dr. Grewal.
Thank you.
And thank you, listeners, for tuning in to the Well Within Reach podcast, brought to you by Riverside Healthcare. For more information, visit riversidehealthcare.org.